Ta'alofa lava and welcome to Behind the Lava Lava Business Spotlight, where we highlight businesses and nonprofits that are making a difference in our community. I'm your host, Michael Tan. In this segment, we place the person behind the business, giving them a platform to share their unique experiences and connect with a wider audience. So our goal is to promote these businesses and give them the visibility they deserve. Our show is brought to you by Matai, a brand that embodies the essence of the Pacific Islands, whether you're searching for a practical watch or sunglasses to wear in your everyday life, or a stylish accessory that complements your relaxed island vibe. Matai has got you covered. So before we get started, a quick reminder to our listeners to follow, subscribe, and leave a review if you enjoy the show. This is Behind the Lava Lava. Let's get started. So today we're excited to introduce Dr. Tui Lauilefue, an American Samoa native who is an internal medicine physician and obesity medicine specialist based in Washington. Ta'alofa Tui.
Ta'alofa Michael. Thank you so much for having me on.
Thank you for joining me today on Behind the Lava Lava. So we'd like to start off with your origins. Could you please tell us your family, where you came from?
Of course, yeah. So my origin, proud native of American Samoa, born and raised in American Samoa, went to school there my entire life for elementary, public school, graduated from the home of the Mighty Sharks, class of 2002, Samoana High School. And as far as my village, I know we always like to rep our villages. We got to do it. So I actually grew up in Tafuna, but my mom, her villages are Whangatongo and Leone. And then my dad's from Lufi and Saluafata Upolu. But I grew up right there behind Whangaima in the Coco Land area. And so grew up with my three brothers, two older, one younger. We all went to public school. We had a very, very fun childhood, which is, it's interesting now moving here to the mainland, right? Comparing to back home where we all grew up, very different. So I'm very grateful that we had to have that childhood experience. So after that, I did move off island to go to school in Hawaii. So I was with the University of Hawaii for undergrad. I did medical school there as well with JABSOM. And then I did all my intern year, my residency training for internal medicine, all in Hawaii as well. And I pretty much stayed there until my family and I moved up to Washington State just 5 years ago. So just before COVID hit is when we then relocated. But it's been a wild ride so far.
So before we get into your business, what set you on the path of being a physician?
Oh, yes, of course. So many things. And as an American Samoa native yourself, I was just, I grew up really in a place where, it was just so hard to see a lot of our loved ones, right? Just being afflicted with a lot of chronic illnesses, and not just chronic illnesses, but pretty advanced too by the time we were seeing them. American Samoa, very beautiful, beautiful place to grow up, but also very resource limited as far as healthcare goes. So looking at that, seeing my loved ones being afflicted with diseases, it really does take a toll on you. And then, not just with your loved ones, but also your neighbors just struggling with different diseases. So these experiences really then planted the seed for me to become a doctor, right? So I was grateful enough to have the opportunity to move off island and then go to school in Hawaii. And then while in school, primary care was always one of those things that I wish was emphasized more in American Samoa. It's like by the time we get sick, we all kind of show up in the emergency room. It was just kind of the thing to do. I think it's definitely changed since I've been back home. I think there's more a push towards primary care now, which is amazing. I think that's where it really starts. It's the preventative care. And that's why I decided to go into internal medicine. I think it really sets the foundation to have that adequate experience or, to get trained enough to be able to cover a wide variety of different chronic disease. And I do hope to go back home at some point to be able to practice and give back to our community. But, life happens, and I found myself here in Washington. But there is also a growing population, right, of Pacific Islanders in this state. So it's still good to be in an area that does, remind you of back home.
So this is mainly for our listeners who are inspiring to become doctors. How was your journey to get to where you are? Was it difficult? Could you explain how your journey went?
Oh, of course. Yeah, no, I definitely love to share my journey. So when I first moved to Hawaii, Manoa, it was definitely a culture shock. Even though you were going from island to a different island, I definitely felt like the curriculum was different. It was a lot more independence than I was ever used to, being like the only girl in the family in Samoa, very conservative, can't really go out and do much. And then all of a sudden you have all this freedom, right? But I remember walking into the student center, right? So you're a new student, you go in, you have to meet with your counselor, you choose your courses. And I remember sitting down with him and then kind of telling him like, hey, I really want to do pre-med studies. I want to get my prereqs done. This is what I'm thinking. And I remember him just looking at me and saying, oh, but didn't you just move from American Samoa and you want to take this course? And I was like, what do you mean? Is that, is there something wrong? So I was really taken aback by that he thought that just because you're from a certain place, and I'm sure he had his own like implicit biases, right? But I was like, yes, this is what I want to do. And, but I had to get him to sign off on it. So he eventually did. But that was the start of really the start of my experience when it comes to medicine. And that really just kind of fueled me, to be able not to just prove to him really, but to myself that it was something that you can do. It definitely is a difficult track, but if you find the right people, I was fortunate enough to come into contact with, just a very good support system when I was at UH, and, you have your family, of course, supporting you as well. But to be able to reach out and find really good mentors who can kind of guide you along that path, knowing what courses to take, getting a lot of kind of outside experience too when it comes to doing like volunteer work and everything else to kind of, make a really good application. And then, of course, being able to study and then pass all the prereqs and the exams in order to go to med school. So again, a difficult but not impossible task. So I'm really hoping that more and more Pacific Islanders consider going into medicine because we are so underrepresented in the field, right? I think there's like less than 1% of us in medicine. So, and that plays a big role when it comes to taking care of Pacific Islander patients. They like to see themselves represented in their providers. So I think it's definitely a big push towards medicine more these days.
Thank you for sharing your journey. And I believe that it's important in any profession or industry that you're trying to enter that you have set foundations and to have good supporters to help you build into the profession that you are trying to head into. So let's talk about your business and what services that you offer. You just recently rebranded your practice. Could you
saw
talk
that,
more
yeah.
about it? Yes.
Yeah. So I just announced it on social media last night. I had emailed all my patients. So a little bit of background. So I have been in private practice for the past 2 years. We're coming up to our 2-year anniversary in January. But prior to that, I was actually with corporate medicine, right? I was in downtown Olympia, and I did it for 3 years. But it was that last year, we were kind of going into COVID. We were already a year in. Corporate medicine is a whole different beast, right? So it's, because you are employed, you really have no say about certain things, about your schedule. And that's why, like, if you, depending on what clinic or what doctor you have or what, healthcare system you have, it's getting really common to have these very, very short visits. You go in, you see them for maybe like 7 to 15 minutes. And then that's it. That's all the time you have. Or they tell you like, hey, you can only discuss 2 medical problems and then that's it. Right. So that's the kind of system that I was in before I went into private practice. And I felt it was just so unfair for a lot of my patients, that because I am internal medicine, a lot of my patients are older. They tend to have more chronic disease, more complex disease states. So I cannot see my 90-year-old grandma patient with dementia who's in a wheelchair, who's also deaf for just 7 minutes. It's just, impossible. So I made the switch from corporate medicine to then just doing private practice. And things have been so much better since then, since I've done private practice. The name that I went with is actually just the county name, right? So I'm in Olympia, Washington, in Thurston County. So it's Thurston Internal Medicine. The reason I went with that name is just I needed something quick and recognizable because I left my job in December, and then 2 weeks later, I opened up my private practice. So it was just a very quick transition. But since going into private practice, again, things are a lot easier. I mean, there are difficulties being your own boss, right? If you're in private practice, if things go wrong, you only have yourself to blame, kind of thing. But as far as seeing my patients, the thing that really is unique about my business is that I operate what is called a direct primary care model. So under this model, I actually don't take insurance. It's more like a monthly membership fee, a low monthly membership fee. But under this fee, patients get unlimited primary care visits. So you can see me like one day that month, or you can see me every single day that month, and the cost would be the same. And the other benefit is, because it is a direct primary care model, I try to keep my panel very low. So when I was in corporate medicine, I think I had about 2,000 patients on average at any given time. And it was hard to kind of juggle that kind of schedule, right? But under this model, we have no more than 400 patients at any given time, right? And then because of that, we are able to offer things like same day or next day appointments. And even when patients do come in, I can spend as much time as needed with them, right? Whether they need 30 minutes or an hour, and that's the beauty of it, is I end up knowing my patients very well. I know their medical history very well. And that's something that they really appreciate. So instead of going into a clinic where you're seeing different providers every time, where you just can't even get in, they see the same person every time they come in. So that's a plus.
Yeah, and that's an amazing service. It's almost like paying a membership at Costco,
Yeah,
where you pay a monthly fee
exactly.
and you get the services that's provided for you. So that's amazing. I only know of one primary care that does that here in Utah, and they're about an hour away. So I
Oh,
couldn't really enroll in a services that's too far for me. So could you talk about some of the challenges that you faced as a business owner since you started?
oh, sure. So some of the challenges that come with medicine, or more as from a business standpoint, it's probably because a lot of it has to do with just my lack of business knowledge and business experience, right? Because I've always just trained, medical school, and then just do training to be a doctor. And I just have an MD. I'm not, when it comes to everything business related, it's been very difficult. It's just kind of something that I've had to learn on the go. But I've also been pretty fortunate. I do have a business coach, and different people that I've connected with kind of throughout my journey, going into private practice, that I've been able to kind of, talk to and bounce ideas off of. The direct primary care community is actually pretty accessible, very, very friendly group of people because it is a model that's not as widely used, right? Most of the clinics in our area and in the rest of the states are still traditional insurance based, right? So I've been able to really get a lot of good advice from them. There are some books that are out too about how to set up things like your LLC, how to get like CLIA waivers to be able to do certain procedures in the clinic. Malpractice insurance is another big thing that you have to kind of shop around for. So when it comes to the business side of things, I've just been fortunate to be able to have that great support system to get help when it comes to those like more business technicalities.
So I want to take it back because I forgot to highlight NiuOla. That's
Yes.
the name of your business
Right.
now. How did you come up with the name and
Yeah.
what does it mean?
Yeah. So thank you for bringing us back. I tend to get carried away into tangents sometimes. But so it was Thurston Internal Medicine. And now it's NiuOla Health, and that's spelled Niu, new like the young coconut, and Ola, Ola. So this name really, I was trying to find something that kind of encompasses everything that I do in healthcare with internal medicine, but then also I'm really trying to niche down to do more like obesity medicine focus. Niu, as we know, right, it's like the tree of life in the Pacific Islander culture. There's so many uses for the coconut, right? Whether you use the fruit for sustenance, the bark, the leaves, you can use it for so many things, shelter, you can weave it. I mean, it can be used for so many. But the symbolism, or it symbolizes resilience, nourishment, and then just overall more holistic health, right? And Ola means life, and I kind of wanted to relate that back to people being able to transform their lives for the better as far as healthcare, but then also a nod to obesity medicine when I'm able to help patients kind of get back to their baseline, by helping them get to a healthier weight. So it's like that transformation. So a very long-winded explanation of NiuOla Health, but I'm very grateful that the change did happen because I feel like NiuOla Health is a much better representation of my brand or just my overall goal when it comes to health and wellness.
I think you selected a name that's very impactful and has a very true meaning to it. But you spoke of obesity.
Mm-hmm.
Now we're going to go into a topic that's very prevalent among Pacific Islanders, our people. What are some common misconceptions about obesity, and how do you address them with your patients?
Oh, I love that question. Fantastic question. So when it comes to obesity, there is still so much stigma about obesity. And I talk about this a lot with my patients. Number one, I always emphasize to them that, hey, obesity is a chronic disease, right? It's like a complex chronic disease state. And I tell them it's not your fault. It's most of it is genetics. And it also depends where you grow up, but majority of it is just you fighting your biology. And we've seen these in different people growing up, right? Where you basically, you're even within families, you're eating the same thing, same level of activity. And yet, you always have that sibling or someone else in your family who never quite gains the same amount of weight as you do, or something like that. But I tell people it's not your fault. It's biology, and there are ways to treat it. And even going through my training as a medical student and even with internal medicine training, there actually was not a lot of emphasis on obesity medicine. At the time when I trained, a lot of it was what you would hear all the time, right? Calories in, calories out. You just need to eat less and move more. But that could be that's so far from the truth and what we really want people to focus on. So I tell my patients, hey, there's no shame. And And by the time they come to me to ask for help with their weight, they've tried everything. So it's not because of a lack of trying. And we know that lifestyle is always great, right? Good nutrition, exercise, that those things play a role. But when they've actually studied it, lifestyle modifications, you can only do so much. And I see this in a lot of patients where the weight just goes up and down, it yo-yos, and eventually they do lose weight, and then it just all comes back and then some. So I tell them lifestyle changes are important, but we also have a lot of good medications that are available and that have been available for a long time. But depending on who they see, are just not being utilized because, again, most doctors, when we trained, we didn't really emphasize that. We just emphasized calories in, calories out, but that's not as simple as we think. So I tell them there's hope. We can treat this. Come and see me. We'll talk about, a lot of, not just talk about, but I end up investigating to see if there's another underlying cause that could be contributing to obesity, right? A big thing that we see back home is diabetes and insulin resistance. And that also that plays a big role and how difficult it is to let go of a lot of that weight. Usually once that is treated, it becomes much easier to then lose the weight. But yeah, a lot of it is just trying to destigmatize obesity, letting my patients know that there's hope, there are options, there are things that we can do, medications that they can try. And depending on the starting weight, a lot of people actually do qualify for surgery too. Which is also another option. It's definitely a higher risk option. But then if you think about the risk of surgery versus the risk of not doing anything to drop the weight, because obesity leads to so many other complications, right? It increases your risk for cancer, your risk for heart attack, your risk for stroke. People end up on dialysis if their diabetes is not well controlled, if it affects their kidneys. So these are all things that I kind of talk to them about. These are your options. Depending on your background, we just weigh out what the risks are versus the benefits and see what the best path is for you. And it's all just customized, right, based on the patient and how they present.
So you brought up something in the beginning about biology.
Yeah.
We're always hearing people, especially Pacific Islanders, say we're just big bone or it's our genetics. What role do you think genetics play in obesity, and how does that influence your approach to the treatments?
Oh, yeah, no, wonderful question. They've done some studies on this really when it comes to genetics, especially in Pacific Islanders, to see if there's something really that we are at risk for, or do we have some kind of genetic predisposition to obesity. So I know that the CDC did mention something called like the thrifty gene. And if you think about like historically with Pacific Islanders, like we are sea voyagers, right? We're used to being on these long voyages. But then because of that too, so we are people who are probably used to just having a slower metabolism and just the way that we can survive during these long voyages. And then holding on to those fat stores, because that does help us, on these long routes, right? So we have stores that we can tap into when there is no nourishment, when there is no sustenance. I don't think they've ever been able to identify the actual gene, but it's funny you bring that up, because I was just mentioning to one of my colleagues, like, I bet if I took like a sample, because there are newer tests that are out now where you can actually test someone for like a myriad of different genetic mutations that predispose them to obesity. So that's something that I was hoping to look into, because I do have patients who are Samoan, other Pacific Islander. I have a good mix. If that's something that they want to get involved with, I think it'll be really interesting to see if we are able to narrow down on what that is. And but just because we do tend to be like a bigger people, and stature is a thing. And we always talk about like, well, back in the day, if you were of a like larger size, bigger stature, that means that, you're probably from one of the more well-off families, right? It kind of went hand in hand as far as like status and that kind of thing. But just because we think of ourselves that way, like, well, I'm Polynesian, so therefore I'll always be like this. Like, no, we don't necessarily have to always be like that, right? People, we can change as far as body composition once you get that treated. And I think that's also important to really look at body composition and not just things like BMI. And I think didn't the military switch that up recently too? So to make it a little bit not as strict when it comes to waist measurement or looking at
Yes.
BMI, right?
Yes.
Yeah, so I think body composition is really the way to go, because you could have someone who's highly muscular, very little body fat, and then they step on the scale and then they're like, oh, you have a really high BMI, but you can't really call that person obese if they're mostly muscle, right? So I think looking beyond the scale, beyond that measurement, and focusing more on the actual composition, muscle versus fat, can really help.
So I understand that women and men have different biology.
Mm-hmm.
What would you say is contributing to weight gain, mostly in women? But, I always hear the hormonal imbalances and the women who are experiencing menopause and thyroid
Mm-hmm.
disorders. Could you elaborate more on that,
Oh,
especially for
sure.
women?
Yep, sure. No, that's a great question. So, as we know, when it comes to women, it's women versus men. Men tend to have a lot more muscle than women. Women, we tend to have a lot more fat. And then even when it comes to weight loss, right? There's certain hormones that regulate our appetite. So things like ghrelin, and then the ghrelin really stimulates the appetite, right? It's like your hunger hormone. And then there are things like leptin, and that really, suppresses the appetite. But women, because we all have the same hunger hormones, but when it comes to other hormones, things like estrogen, progesterone, things that are around like menstrual cycles, and especially when we hit menopause, that's when the weight gain really comes in or kicks in for a lot of women. And this is also something that's big that I see in a lot of my Pacific Islander patients, is that PCOS, right? So that's the polycystic ovarian syndrome. And this is tied very closely with insulin resistance, and that also increases diabetes risk. But I do see this a lot in our Pacific Islander patients. And that also, goes back to obesity and increases the risk for that too. So, and then looking at the numbers, as far as the statistics, Pacific Islander women have a very high rate of obesity, actually. And if you think about the top 10 countries of the world that are the most obese, are all Pacific Islands. They're all Pacific Islands. So that is something that is known, or that has been established, but not a lot of people know that. So that's something that I've been really trying to advocate for, in order to get more resources, right, to help set up like programs and things to be able to help address that, especially with back home, because that's where a lot of it is really.
Yeah, thank you for sharing that. And it was mostly for our women listeners, so that they could understand that they can't really compare themselves to the men out there because the biology is different.
Mm-hmm.
So in terms of medication, I saw that you were advertising a medication for weight loss on
Mm-hmm.
one of your videos. Could you speak more about it, and what medication do you advise for weight management?
Oh yeah, so I think you may have been referring to the video. I have no financial disclosures. I have no relationship with this company, but the latest medication to be approved for chronic weight management is ZepBound, right? So the active ingredient is terzepatide. So it really is the same thing as Mounjaro, and Mounjaro, it is a once a week injectable. It's a GLP-1 agonist, GIP as well. So the way that it works is it helps kind of slow down the way that food moves in your system. It also helps regulate your hunger hormones. And for a lot of people that usually have food on the brain, it really helps to quiet that food noise. So you're not always having to think about food. And that really helps people to cut back on those cravings. But it also, now that they're seeing more and more people use it, they're saying now that it's been helping people with certain addictions, like alcohol use has gone down too because of that. And there's some fat burning going on also due to the use of this medication. So ZepBound is the FDA approved medication for obesity. There are other types of medications that have come before that, right, that are very similar, but not necessarily approved for weight management, right? It was mainly for diabetes. But then they saw that the diabetic patients, not only were their sugars under better control, they were also losing a good amount of weight because of that. And we now know that being overweight or being obese, a lot of it does have to do with our ability or inability to regulate things like glucose and insulin. So there's a lot of dysregulation, and those medications really help to level the playing field, right? So it makes us utilize our insulin a lot more effectively, and then as well as the sugars. So there are other medications approved, FDA approved for chronic weight management. There are pills that have been around for a long time. Things like Qsymia, Contrave, Wegovy is another shot that's approved. Let's see. There's also Orlistat. Metformin is another big one. It's approved. Metformin is approved for diabetes, but patients who take it for diabetes, they do end up seeing some weight loss too if they take it long term. And that's another good one for PCOS as well. So, I mean, we have so many different options, and depending on whether or not you are somebody who has certain indications, or sometimes it might not be a good idea if you have something or a risk factor that will not be, that'll be harmful if you take the medication. So that's why it's good to get a good history. And then also for your listeners, if you're someone who's been struggling with your weight, definitely bring it up to your physician and then see what options you have, because it's one of those things where unless you bring it up, it's so hard to advocate for yourself and for your weight. And if you're finding that it's difficult to talk to your doctor about it, or if they're resistant, then there's nothing wrong with getting a second opinion, or go see, seek someone else who can help you. Obesity medicine specialists, they are not as common as say your regular PCP, but there are some PCPs who do obesity medicine. So it never hurts to ask. And we do have options that are effective.
So I have to ask this question because one of my co-hosts who was supposed to be here isn't here to ask it. He wanted me to ask you about Ozempic. What do you think of Ozempic?
So Ozempic came out before Mounjaro, right? So Ozempic is a GLP-1 agonist. And when it first came out, it was mainly for diabetes only, right? Diabetes only. But then they rebranded it because Ozempic, the active ingredient is semaglutide. So they rebranded it, took the same medication, put it in a different pen, right? And called it Wegovy, right? So, but now Wegovy is the same thing as Ozempic, different dosing, but Wegovy is the one that's approved for obesity management, right? Or chronic weight management. Ozempic is a pretty effective drug. I think about when they studied it, they looked at the numbers. On average, about 15% of weight loss, or 15% weight loss starting compared to your starting weight, right? But the problem that a lot of people have is it does have a lot of side effects, things like nausea, vomiting. So you learn real quick to not eat certain foods when you do Ozempic. But that's kind of good negative feedback too, right? So if you try to overeat on a medication like that, people often, end up feeling very, very sick. So then they kind of know to eat smaller meals, and then that helps overall with weight loss. But compared to Mounjaro, though, Mounjaro or ZepBound, that's the newest one. Mounjaro is more effective at weight loss. Both help to reduce your A1C or improve your diabetes, but Mounjaro also has less side effects. So if you did not do well on Ozempic, and you have insurance that covers for something like Ozempic or Mounjaro, you can always ask your doctor to, hey, maybe let's switch me to Mounjaro since I'll have less side effects. So.
Yeah, thank you for sharing that. And how do you stay current with the latest research that's out there and developments in both internal medicine and obesity medicine? And are there any that you're excited and looking forward to that's coming up?
Yeah, so as part of my having a medical license, it's a requirement. We have to stay on top of all the latest and greatest, right? So we have CME, or that's continuing medical education. So every year, at the end of the year, we have to submit, okay, this is the CME that I did, whether it's you go to in-person conferences. But since COVID, it's now an option to do a lot of those conferences virtually, which works great for my schedule because I have a 2-year-old. So we're able to do things online. We're able to, participate in virtual learning. We can answer questions at the end of it. You can even be a speaker at a virtual conference and then just, be at home and just Zoom live to everyone. And then as far as the licensure, so obesity medicine, it's once every 10 years, but you can do shorter certification if you don't want to do like the big exam at the end of 10 years. Same thing with internal medicine. It's once every 10 years. So my license is not due until 2025. I have to take my big test again. So I still have some time before then. But yeah, lots of good CME out that we can take, just to stay updated with what's going on in the field.
Now, I want to bring it back to your business. I know that you've had a lot of clients. Could you share some of your experiences and some of the success stories or client testimonials that you've had since you've been in this career?
No, that's a great question. Thank you. So something that I'm really proud of is I recently launched a weight loss program. It started in August. So right now it's December. So we are going into it's a 6-month program. So we're going into month 5 and month 6. And majority of my patients so far have lost about like 10% or greater of their weight compared to the starting. And not everyone in the program is on medications. I mean, I have patients who would prefer to just do the lifestyle. So it's a whole mix of people. But I do enjoy working with this particular group because we have these biweekly Zoom sessions, so we can go on together. And then usually I focus on a specific topic, whether it's nutrition. Mindset is also a big thing when it comes to, changing your behavior, developing good habits, good routines when it comes to things like that, nutrition, exercise. So when we meet on the Zoom sessions, we share wins, and if people are having struggles, because it's a group coaching session, people can then, just kind of chime in, and, we share ways to troubleshoot. We share, what was I going to say? We have weekly challenges that we participate in, and then we have like a private Facebook group too, right? So we have that accountability, we have the support. So it's going through a weight loss journey. It's not easy, and it's always better when you have like an accountability buddy, or if you're going through it with a group, right? So it's really hard to go at it it on your own. And it's funny because I have patients who do it and they're like, they have a spouse who's not in the program, but usually whatever plan the person is on, or my patient is on, the spouse ends up being on the same plan, right? So it's like, I lost weight, but so did my husband, because he has to now eat whatever I cook or whatever healthy food I cook. So that's been interesting to see. And then we also do, I run a local, it's a free community event. It's Walk with the Doc. So I meet with whoever shows up at a local park, and then we just walk for like an hour, sometimes less, depending on the weather, because it's so rainy here in Washington State. But that's just a good way for people to get out of the house. It's more for the community than anything. But just get some steps in, get everyone out, and it's good to see people outside of that sterile kind of clinic setting. So hearing their wins, and I try to post it online too. That way we can kind of celebrate as a group. It's been really, really satisfying to see. And the thing is, I'm just so grateful to be able to help people in that capacity, right? To be able to make a difference in someone's life, whether it's just through weight or just, I have a lot of patients who are not, weight loss patients, just for my primary care patients, but I feel pretty fortunate to be in this field. So it's something that I really enjoy, no regrets. And I'm glad I didn't listen to that counselor that I had back at So
You mentioned giving back to community through some of the ways that the events that you've held. You probably also hold some training and education classes for the community, but what kind of community support do you need from our people and those within Washington to help you thrive in your business?
Yeah, so that is a really great point, because at this point in my business now, in the beginning, I was really focused on getting everything set up. I do have a brick and mortar, right, a building, but now I'm really trying to focus on networking and just getting my name out there, getting my services out there, just getting people to know who I am and what I do. I have been in contact with certain organizations, and it was funny because there was a Polyfest that was in my community this past summer, and this lady, I was offering free blood pressure checks, and this lady comes up to me and she's checking her blood pressure, and then she introduces herself, but I didn't really think, I was like, oh, what a nice lady. And then like a couple months later, she finds my social media, and then she invites me to come and be a speaker to their organization. And it turns out she was the chairman of the Asian Pacific Islander Coalition of Washington. So making those connections, I feel like if I'm not putting myself out there, people are not going to know who I am. And, I could think that, oh, I'm offering these amazing services, but if nobody knows who you are, it's you're not going to be able to serve anyone, right? So, and that's one of the reasons why I really enjoy your podcast, giving us, the small business owners, an opportunity to really get our names out there. Even though we're in different states, I mean, Pacific Islanders, it's a small community. Somebody knows somebody who knows somebody who's in Washington, right? So networking is a big thing, being able to just make those connections, so I could do more. So that's really, really what I'm trying to focus on right now.
So that's one thing our people underestimate, is the power of networking. And that's how I've been able to establish my podcast and get our name out there, is to physically go out there in the business meetings and workshops, and just to let people know of my brand and how I can help them. Just basically use Behind the Lava as a resource. So I hope, especially those who are in business, they realize the importance of networking, because there comes to a time where we're so focused on working that we ignore the little things that can greatly boost our presence, especially on social media. So
I agree.
Yeah. So do you have any advice for our listeners who are who are struggling with weight management, and mainly because they think they have limitations or health concerns?
Yeah, so my advice is, if you don't have a primary care provider, that's where I would start. Definitely go in and see them, let them know that that's your primary concern. And it's sad because it's not uncommon that when patients who look a certain way, if you're overweight or obese, you come in, and this is just an example, and you have knee pain, and then they just end up saying, well, you got to lose weight before we can do anything. You can't get a, steroid shot. There's going to be no imaging. And if you find that your provider, or doctor is dismissive of you, please seek a second opinion. Go and see someone else, because there are a lot of different kinds of providers out there. If you could see an obesity medicine specialist, that would be even better. And a lot of their services are covered by insurance. So depending on what your insurance coverage is, I think it's definitely worth seeing someone if weight is something that you have been struggling with. So I do have a medical license in Washington, but I'm working on getting a medical license in Hawaii and Alaska. I tried for Utah though, Michael, but my malpractice insurance told me, no, we can only cover 3 at a time. So I'm starting with the 3 total that they allowed me to get. So Hawaii and Alaska, those licenses are coming soon, but yeah, start with your PCP, look around in the area if there is a obesity medicine specialist that can see you. But again, obesity, it's a chronic disease. There's no shame in seeking treatment for it. Much like hypertension is a chronic disease, diabetes is a chronic disease. People are on medications for that all the time, and we don't blink an eye. So it should be the same thing when it comes to obesity management, right? So there's hope. You don't have to live at the same weight that you've been for a long time. Things can change. Your life can get better. So,
Yeah, thank you, Tui. How can people find you, and where can people reach you if they want to ask you more questions or they want to utilize your services?
oh yes, so excellent question. I'm trying to be more active on social media, but it's hard, running a practice and then having to keep up with the posts. But I do have Facebook, right? I think it's just Dr. Tui Lauilefue. I'm now under NiuOla Health. I also have Instagram, Doctor, so it's dr.tui on Instagram. And then I have TikTok, so it's Doctor, so dr___ Tui, because the Dr. 1_ Tui was already taken. So I had to do a double underscore. And then you can visit my website too. I haven't changed it to NiuOla Health yet, so it's still thurstoninternalmedicine.com. But yeah, feel free to message me through social media. A lot of people, since I've started being more active on social media, a lot of people have already reached out to me and it's amazing how small or how connected the Pacific Islander people are. I've had people reach out to me from New Zealand, from Australia, just sharing their stories with me. And it's been so, touching just hearing these stories and people just sharing with me. And we don't know each other, but they kind of see themselves in the stories that I posted and things that just resonate with them. So I'm just encouraging people to, if you don't have a regular doctor, start there first and then go from there. But yeah, if anybody wants to reach out to me, just do it through any one of those means.
And thank you very much, Tui, for joining us today at Behind the Lava Lava. We greatly appreciate you taking the time to chop it up with me on our platform so we could highlight your business and what you do. And do you have any closing remarks?
Again, I would like to thank you, Michael, for allowing me to be a guest on your podcast. Again, I think this is such a great platform to allow us to highlight, our businesses and to be able to get the word out there. If you are somebody in Washington State, you need a new PCP, or you need help with weight loss, definitely just hit me up. I'd be happy to see you.
Yes. check out Dr. Tui. So thank you for tuning into this episode of Behind the Lava Lava Business Spotlight. I hope you enjoyed our conversation. Remember, the businesses we feature in our show are always looking for support. So be sure to check out their websites and social media pages to learn more and see how you can get involved. If you enjoyed this episode, be sure to follow Behind the Lava Lava and leave us a review. And thank you for joining us. This is Michael Tan signing off from Behind the Lava Lava. Tui Lauilefue.